I'm serving as a co-principal investigator on the Heartland Study, investigating the health effects of herbicides in particular on moms and babies. HHRA is taking a far more integrated approach, multidisciplinary approach. It's actually focusing on people in the heartland and focusing on herbicides that are entirely understudied and not well understood. So the Heartland Study and the Heartland Health Research Alliance is recognizing the key role that paternal health plays. And so we're really going to get a more comprehensive answer to this question. So I'm really enthusiastic about how informative these data and this study is going to be.
We began our work from the perspective of a bedside doctor, wondering why premature births happen, and as a corollary, why do they mostly happen during the month when the pesticides are highest? We found that the birth defect rates also peaked in the month mothers were conceiving their child, that happened to coincide with a peak occurrence of pesticides in the environment. So between premature birth and birth defects, we have the two main problems that lead to death in the first year of life. It's not just being next to the farm that they're getting exposed to. It's also in their food. So premature birth is on the rise. Mother's death is on the rise. And that suggests that something really important is changing that's not good for our health.
It's such a complicated system of interchange between mom's health, the intrauterine health and environment, and the baby's development until the time of birth, that it's something we have to study in a complex way and in a complex system. We know there's healthcare disparities with rural women, rural people in general, as opposed to those who are in more urban areas because there's better access to healthcare. But I'm really excited about the Heartland Study really going the distance to try to recruit people in rural areas, because we can really understand the impacts of these exposures really well in a population that sometimes is just not included very often in clinical research.